Hello everyone, this is Marwan from the Daily Pharma channel. I am excited to welcome you to the first lecture in our Pharmacology Made Easy series, titled An Introduction to Pharmacology. In this lecture, I will cover the following topics: definition of pharmacology, a short history of pharmacology, the difference between drugs and medicine, sources of the drugs, principles of drug classification, and finally, fundamental concepts in pharmacology. First of all, pharmacology is the study of the action of drugs on living system, and this includes a number of properties, including physical and chemical properties of drugs, biochemical and physiological effects of drugs, mechanism of action, therapeutic uses, and adverse effects of drugs as well. Regarding the history of pharmacology, Jonathan Pereira, a British scientist who lived from 1804 to 1853, is renowned as the father of pharmacology due to his pioneering research and documentation of drug information. His most notable contribution was his book The Elements of Materia Medica and Therapeutics, which was the first comprehensive work on drugs and their uses. Later, Oswald Schmidberg became known as the father of modern pharmacology due to his extensive research on drugs such as nicotine, chloroform, and digitalis. He was also a pioneer in establishing institutions dedicated to the study of pharmacology and played a crucial role in training a generation of pharmacologists. In medical science, especially in pharmacology, we commonly use the terms medicine and drugs, but there are important distinctions between them. Drug is the active ingredient of a product that can alter the structure or function of the body. This includes both legal substances, like prescription medications, and illegal substances, while medication is the whole component of a product, typically include the active drug along with the other components, like fillers, binders, or preservatives that help deliver the drug effectively and safely. Another difference is that drugs can be used for various purposes, including treatment, prevention, diagnosis, and even recreational uses. They may have therapeutic effects, but they can also be harmful or addictive when misused, while medicine uses it to treat or prevent disease and maintain health. That's why the term medicine implies a beneficial therapeutic intent and is usually regulated and approved for medical use. There are a number of sources of drugs, which include plants, animals, minerals, microorganisms, scientific and semi-scientific. Drugs can be classified in several ways. Firstly, according to their clinical effect, for example, antibiotics, antidiabetics, and antihypertensive. Another way to classify drugs is based on their mechanism of action. For example, drugs can be categorized as H2 receptor blocker, proton pump inhibitor, or beta blocker, depending on how they interact with the specific physiological processes. The third way of classification is according to their chemical structure. For example, drugs can be categorized as penicillins and cephalosporins, which reveal their chemical structure. The final way to classify drugs is by their source. For example, drugs can be categorized as scientific, semi-scientific, natural, or derived from animals, depending on their origin. There are two fundamental concepts in pharmacology that describe how drugs interact with the body. They are pharmacokinetic and pharmacodynamic. Pharmacokinetics answers the question, what does the body do to the drug? That's why it's the study of how the body absorbs, distributes, metabolizes, and excretes a drug. While pharmacodynamic answers the question, what does the drug do to the body? Thus, it's the study of the effects of the drug on the body, including the mechanism of action, adverse effects, and contraindication of drugs. Thus, every drug can be studied through two pharmacological perspectives: pharmacokinetic, which examines what the body does to the drug, and pharmacodynamic, which explores how the drug affects the body. In the next lecture, I will discuss pharmacokinetics. If you enjoyed and found this lecture helpful, please subscribe to the Daily Pharma channel and click the bell icon to be notified about the upcoming lectures. Thank you for watching.